In this work, well, as there is previous evidence showing sex differences in many aspects related to Alzheimer's disease, however, it is unclear whether there are sex differences in plasma biomarkers, which are recently developed and starting to be implemented now in clinical trials. So we were interested in testing that possibly sex differences in plasma biomarker levels and how they associate with cognitive decline. So we studied that in two cohorts, in the ADNI cohort and also in a cohort from Barcelona, the Alpha cohort, in cognitively unimpaired and MCI individuals. And we found sex differences in the levels of amyloid beta 42/40 in plasma in the MCI group, with men showing lower, therefore more pathological levels compared to women. While in relation to how these baseline biomarkers associate with cognition, we found some sex differences in also amyloid beta 42/40, meaning that this biomarker associates with cognitive decline specifically in men, in both MCI and cognitively unimpaired. And finally, only in the MCI group, we found that plasma p-tau 181 and NFL associate with cognitive decline also, but in this case, only in women. So there seem to be some sex disparities in how these biomarkers associate with cognitive decline. So first of all, these findings are in line with, in terms of biological meaning or mechanisms, seem to be in line with previous evidence showing that women might be more resilient in early stages of Alzheimer's disease to amyloid pathology, while when they are they compare to MCI, they seem to show steeper declines, and we seem to be finding this in terms of p-tau and neurofilament light being amyloid beta downstream processes. So these biomarkers, p-tau and NFL, seem to be more strongly associated with cognitive decline in women. And what these results also emphasize is the need to really look for sex stratified results in the biomarker studies and in clinical trials, because we have, well, potentially there are differences that should be taken into account. And of course, we need to confirm these results in replicating the MCI findings and in a bigger sample. But if they are confirmed, they might imply tailored interpretation and applications of the biomarkers well, considering sex and the risk group of each individual, for clinical trials application and for clinical practice eventually.